So let's go ahead, let's have you raise that shoulder of yours. Go like this. High as you can. It's right there.
Right there.
Right? Okay. Why don't you go now sideways? Yeah, raise it up slowly.
It hurts.
Understood. Alright. So, as you can see in the viewers over here, this gentleman over here, he has a lot of trouble lifting this right shoulder of his ever since he fell in the snow. So this is what we call adhesive capsulitis or frozen shoulder. Alright, champ. We're going to start off looking for abnormal temperature, and we see a very big one right on this side over here. So this one's chronic, and we found another one right there. Alright, so we have a little band right here. You feel that little speed bump there?
Yeah.
Yeah, so we got some edema here. And we got even more edema, mostly on the left hand side, right between the sacrum and this fifth lumbar over here. It's all across. Yep, all across. So when we start to feel the whole entire band right across from that fifth lumbar and the sacrum itself, it may indicate a base posterior sacrum. So we're going to double check on the film to confirm that. And no such, not too bad. Yes, jammed on this side, jammed on that side. Yeah, it's stuck over here. Left hand side, also stuck. Right hand side. Yeah, we have some chronic swelling right on here. Muscle tight on this side and flaccid, soft on this side. Now we're testing for any abnormal movement, and there is. It's fixated, it's stuck right here. There we go, it's fixated and stuck right there, fit cervical. So this is what we identified, we tested and confirmed. What I'm seeing over here, there's not much of a disc in here. It's worn down significant enough to the point that where normal, you should be over here.
Okay.
X-ray shows you have this,
Wow.
all at the very end. Why is that? Because since this bone over here, the foundation, it got stuck, wasn't moving, therefore everything above it has to move a lot more to compensate.
Okay.
That thing was trying to compensate, and that's what caused that disc to wear out so much faster than it should.
Oh, right.
So therefore, yeah, this base posterior sacrum, this is what we need to correct first.
Okay.
Next step along the way is this one over here, right? That's that 6th dorsal over there. And then the next component, right, is that fifth cervical.
Okay.
So, the other thing I want to also demonstrate is, as well as what's going on with your case, is your pelvis is supposed to be like over here.
Okay.
Right? It's supposed to be nice, proper alignment.
Right.
But however, what your pelvis did was interesting enough is it twisted here, and then at the very end over here,
Oh.
you start twisting opposite direction, like this way.
Yeah.
So that's what we got to twist over here. But if you see in the grand scheme of things, when you start twisting here and then start twisting there, so you start to get twisted up in the middle.
Yes.
When it gets twisted up in the middle over here, it has the potential to affect this shoulder over here.
Okay.
So that's why we need to basically restore the biomechanics from your spine from being all twisted up like this
Right.
to much more proper alignment
Okay.
in this way. So the strategy to correct this problem is such as this. Because right now, your fifth lumbar and your sacrum, everything's rotated this way. The
Yeah.
fourth and the third are rotated this way.
Yes.
So in essence, what's going on is because it's rotating counter directions, this way and that way, okay, when we correct this bottom one
Yes.
and move it towards this way, as we see over this one, it's going to make it temporarily worse.
Okay.
Right? So then once again, because it's this way and this one is already that way,
Yes.
when I correct this, it's going to move like this.
This. Right.
So don't be surprised, okay, after we correct this and the next day or two, you may feel a low back pain even higher up than you usually do.
Okay. Yes.
On the future visit, we do need to address that area.
Okay.
First things first, we're gonna pump this up because this disc has degenerated. So we got a nice defined disc in there. So pump it up before we set it until we feel this thing loosen up. Right there. There it is.
Yes, I can walk better now. I can walk better with a knee. Before time I used to drag like this. I used to drag like this before. But now I can walk. I can walk. I can walk.
See, that's what we mentioned before. You know, when we corrected that base posterior sacrum, because all your pelvis, everything was like moving inwards like this.
Yes, I saw it on the film.
So, yeah. So that's why it was such a serious rotation itself. So that's why after we corrected that, it just realigned everything. And your knees and the feet, they'll follow along where the foundation's going.
Okay.
So that's why it took all that strain right off of that fella.
Right, right.
There's nothing, we just double checked on that one. Both of your knees, there's nothing for me to correct in there.
Okay, thank you so much. Front. Yes, it can get a little bit more higher.
That's good. Now, on the sideways, go this way. Try it again.
Yes, this can be better now.
Here it is. There we go. Go ahead and check an SC joint. AC joint, nope, that's jammed. So now we're gonna just gently just guide this superior EC back where it's supposed to be. Okay, now it actually needs to set. Okay, just relax. A little more. There we go. Good. That's one part. Now we can start gently working on this. There we go. There's another component. Let it go. A little more. Try again.
Much better. Much better. Yeah. Yes, much
Try to
better.
go as high as you can.
I can go high now.
And try the forward one again. No, this way.
Okay.
Try again.
Yeah, it's better.
So you said 85%, you know, 85 to 95% improvement last time. How's it now?
It's about 92%. It's good. It's getting better because
Getting better and better.
I had a pain for like 5 months. So I feel better. I can do this. I couldn't do this. You know? I couldn't do this. When I now came in, the doctor came, I saw him on YouTube and I was so happy to shake his hand, you know. I feel so happy that I saw him and I know he can help me. So when I go to shake his hand, I couldn't lift more than this. So then he gave me the left hand. Now I can send my hand and shake his hand. Thank you. God
I
bless
remember you were flinching a lot when we tried to like reach for that
Right.
hand.
Yeah. But now I can shake your hand. You see. But then before I only can do this. Oh, doc, my hand is hurting. I can't do it.
Mm-hmm.
But now it's better. I can shake your hand.
There we go.
Thank you.
Oh, you're very welcome.